Hello, I am back. I'm excited to be with you again today. I'm having a hard time getting on the screen again. There we go. I'm here. I am excited to talk with you and answer questions. These are always so great because you always have amazing questions, and I feel like it gets me thinking as well, and I love that. I just to start us off here before we get questions coming, I had an interesting meeting this morning, bright and early, 7 a.m. this morning. I met with some doctors and we were talking about protocol or treatment options for people who are needing help with sleep, with getting enough air, with all those kinds of things. So, sorry, making sure that this is all going on. Yeah, I think it is. Um, Making sure that people are getting enough air when they're asleep. And there was really an interesting thing I'd never thought of before. I've known the importance of breathing through your nose, but I didn't completely understand all of the reasons why that was so important. And this actually goes to talk a little bit about mouth taping, because this is something that a couple of my family members do every single night because it helps them to sleep better. But the key is the nose breathing. The reason is when you breathe through your nose, and you can practice this right now, start to just, stop breathing through your mouth. I can't talk and do this at the same time, but stop breathing through your mouth and just breathe through your nose and pay attention to what your tongue does when you do this. So I'm going to do it for just a second. Can you see how your tongue goes to the roof of your mouth? It actually goes to the roof of your mouth and creates a little bit of a suction, a seal against the roof of the mouth when you breathe through your nose, because it has to pull the tongue forward out of the airway and divert it so that the air can come from the nose down into the airway or the tube that you breathe through. So the key with that is if you breathe through your mouth, that suction isn't created. So it doesn't pull the tongue up and forward like we want it to be. It actually lets the tongue fall back wherever it can go. So when you're mouth breathing, the tongue is able to fall right back into the airway. And that's most often what causes snoring. It's what causes sleeping problems, like having to wake up at night, not being able to fall asleep very well, waking up earlier than you want, not being able to go back to sleep. All of those kinds of things are largely related to that nasal breathing. Not only that, but when you breathe through your nose, it humidifies the air. You know how when you breathe through your mouth, like when I'm sick and I can't breathe through my nose and I breathe through my mouth, I feel like I have the Sahara Desert in my mouth. When I wake up in the morning, it's because the nose actually humidifies or puts a little bit of water and moisture into the air. It filters the air. That's what snot is. I tell kids all the time, it's what snot is. It's all the gunk that we breathe in. So if you're breathing it in through the mouth, it can't filter it. It filters the air. It also creates something called nitric oxide, which is essential for growth hormone. And you might think, well, I'm adult, I don't need growth hormone. You actually do. We use growth hormone to repair every single cell and every single system in the body. So we absolutely need growth hormone. It also vasodilates. Basically, it makes your blood vessels bigger so that you don't have high blood pressure problems. There's so many components that go with nasal breathing. So what if you can't? Well, that was the cool thing about this meeting that I was on this morning. It was talking all about what do we do in case if someone can't. And there's a lot of things that we can do with appliances in the mouth to help open things up. But there's also some sprays, some not like a strip, but actually a little magnetized thing that goes here that lifts up. So here's one thing you can try at home. So breathe through your nose. See how you breathe. And if I breathe through my nose, right now I'm breathing a lot clearer through this nostril than this nostril. Then I want you to do this. Pull your cheeks up just a little and breathe again. Do you breathe easier when you do that? If so, then some sort of little lift will help you, or doing an expansion appliance, those kinds of things. Anything to give you more room inside the nose is going to be able to help you. So if you're struggling with sleep, if you have issues with feeling fatigued, tired, even if you feel like you slept, but you woke up really tired, most likely you're not getting into deep sleep because tongue tissue is falling back, not allowing you to get the air you need. There's a lot more that goes into it, but that was just a really interesting thing I learned about the tongue suctions to the roof of the mouth when we nasal breathe, when we nose breathe, and it enables air to get through. So very interesting. All right, let's jump to some questions here. This is what I heard from someone. Is it true? Chemicals are absorbed into carbon filters. Minerals cannot be absorbed. That's why if you use charcoal toothpaste, your medications will not work well, if at all. The charcoal has carbon in it that will absorb whatever medication you are swallowing. This is actually true, but I'm going to tell you why it's okay in the tooth powder. So charcoal is the thing that they use. Like if your child ingest something that they should not be using, and you call poison control and say, oh no, my child just drank whatever it was, toilet cleaner, what do I do? Well, they're going to say, go to the Instacare right now, or give them charcoal, give them activated charcoal. Why? Charcoal is an amazing absorbent. Absolutely. It will absorb things that are in the stomach. So that's the key. It will absorb what's in the stomach when it's ingested. So 2 things that are important about the tooth powder. Number 1, we're not using it along with food. So if you do ingest any, it's going to go into the stomach and it's going to go out of the stomach. Unless you're taking all of your medications at the same time you're using the tooth powder, it's not going to affect them. But it's still not really going to affect them because it's volume. If you have a problem with, you call poison control, they send you to the Instacare, whatever, the volume of activated charcoal they're going to give you is large. They're going to give you a whole bunch. They want it all to go into that stomach. They want it to absorb everything that's in there. And this is going to be a very massive dose. Well, what we have right now is a very small dose. We're using just a tiny little bit in the tooth powder. And the purpose is exactly what we just talked about. It's absorbing. So what we want it to do is we want it to absorb things that are in the mouth, things that cause stains, things that cause issues. So yes, it does absorb. And that's the reason that we put it in the tooth powder. However, it's in such a small dose, it's not going to affect your medication, especially because you're not doing this along with your medication. Your medication goes in your gut, it's absorbed, it's moved out. Then the charcoal comes in later, or maybe the charcoal comes in before, it absorbs, it moves out. It's really not going to be an issue with medication. But I appreciate the question because it brings up, what does charcoal even do? It absorbs stuff, which is what we want in the mouth. In your sensitive product, you have arginine bicarbonate. I try to avoid bicarbonate as it is more abrasive. Just checking on this with you. Is this also about sodium bicarbonate or arginine bicarbonate? Okay, so this is a really great question. And it's all about chemistry and definitions. So we sometimes use the word bicarbonate to mean baking soda, but really that's sodium bicarbonate. Bicarbonate is just simply a salt form of anything. So you can take any chemical component and make a bicarbonate out of it. So when you're talking about, baking soda is abrasive, which actually I'm going to debunk that myth as well. But when we have arginine bicarbonate, all it is the salt of arginine, which research has shown to be very effective at plugging tubes in teeth and desensitizing. So that's why I use it. It's the active ingredient in Tom's of Maine sensitive formula. Actually, our tooth powder is one of the only powders that has this component, but it's extremely effective. There's a lot of research showing it's very effective. So let's talk about bicarbonate or sodium bicarbonate or baking soda being abrasive. This isn't true. So a lot of people ask me, do I have basically an abrasivity or an abrasive, a number that says how abrasive things are? Do I have that for our tooth powders? I don't. Number one, because it's usually a couple of year-long process to get that from a laboratory. But I use something else called the Mohs hardness number. So what the Mohs hardness number is, it's the hardness level of anything in the world. And this is why, when we talk about, you've heard a diamond will scratch glass. Well, why will diamond scratch glass? Because diamond is harder than glass. So anything harder will scratch a softer surface. This is why when somebody has porcelain crowns, old-time porcelain crowns on the front top teeth, it often is wearing down the bottom front teeth because that old-time porcelain is much harder than enamel is. So it will scratch it. It's glass in essence. Well, we use the Mohs hardness number for the components in tooth powder as well as the things that your teeth are made of, so enamel and dentin. Mohs hardness number of enamel is a 4 to 5. Dentin is a 3 to 4, somewhere in that range. Everything in our tooth powders is 4 or lower. So we want to be careful, first of all, on really receded areas that we don't want to use a lot of pressure because we don't want to scratch it. But baking soda is down in the 2 realm of the Mohs hardness number. You can look this up. It's spelled MOHS. Look up MOHS hardness number of baking soda. Anything that has a smaller number than 5, because that's what enamel is 5. Anything that has a smaller number than 5 will not damage enamel. So baking soda is actually not abrasive to enamel. This is kind of one of those myths that isn't true. So I'm glad that the question came up so we could talk about both of those things. And arginine bicarbonate is not baking soda. It's just a salt of arginine. If cavities are filled with white fillings and the filling is wearing out, is it likely that they get refilled naturally by using products with hydroxyapatite? Great question. No, they will not get refilled by products with using hydroxyapatite, because if you have a filling that's getting quote unquote washed out or wearing out, it means that some of those particles of filling material are actually leaving. And what is the filling material made of? It's made of a glass and resin mixture together. So it means you're losing glass, you're losing resin. So hydroxyapatite isn't going to be able to repair that because that's not the thing you lost. So if you have a filling that's wearing out, you're going to need to get a new filling placed. You're going to need to put back what was lost. Same thing we talk about with fluoride. We just put back what was lost, not what was never there. I can see that my teeth have enamel, but lost a lot of the natural white dentin. Can this ever be improved with hydroxyapatite? I'm thinking not, but I would ask. My teeth are not stained, but I have lost that whitish luster. Okay, actually, let's talk a little bit about this because the enamel is actually the thing that you're losing, and you've lost the naturally white, or enamel is naturally white. Dentin has a lot of color to it. So you've lost the enamel, sometimes from wear, sometimes from acid, sometimes from a bunch of different things. Hydroxyapatite is what enamel is made of. So absolutely, this is actually why hydroxyapatite whitens, because what it does is it adds more minerals to the surface of the tooth, makes it stronger, makes it whiter. So yes, you're losing enamel, and the hydroxyapatite will help that. You're starting to see a yellower hue to the tooth because the dentin underneath is yellower. So the enamel is thinner, so we can see more of the dentin through. As the tooth thins, you can see that the tooth becomes more yellow. Not that the tooth becomes more yellow, you can just see more of the yellow part of it. So if you make the outside layer stronger, thicker, it will become whiter and brighter. I use your Kuhlman toothpaste. Is the hydroxyapatite likely to cause sensitivity? Just checking if I need to allow for this. Is hydroxyapatite irritating at all to tissues? The answer is no. It's not irritating to any tissues. It is simply the mineral the teeth are made of. So it should not be sensitive at all. The only thing that I have seen sensitivity with is sometimes it cleans so well. There's all sorts of tubes, especially on the roots of the teeth. There's also sorts of tubes that go all the way to the nerve of the tooth. Well, we want those tubes to be plugged so you can't feel cold water going to the nerve of the tooth, that kind of thing. Well, sometimes it's plugged with what we call biofilm and other things that are plugging up those tubes. And the hydroxyapatite tooth powder cleans so well, sometimes it cleans out those bugs and biofilms and things that are in the tooth. And so you can get a temporary sensitivity, but then the hydroxyapatite is going to plug that tube right back up again over, a few weeks time. So there may be some short-term sensitivity, but it's not because it's an irritant. It's because it cleans really, really well. Acne, any ideas on what truly works? So acne is hugely related to gut function. That's a big one. It's related to hormones. That's a big one. It's also related to products and things that we put on the skin. So for any of you who's been following me for a while, you know that I've really struggled with rosacea, with issues with this area right here. And I've gone through a very, very extensive process to help that. And it's definitely much better than it's been in years and years. It's because I'm doing a lot of exfoliating and removing dead skin cells and cleaning things up. I'm also very focused on my gut and my diet. So unfortunately, acne is not a one-size-fits-all kind of fix. We're working with my daughter on it right now, and we're working to do the same thing, exfoliate the skin very, very well, clean out all the dead skin cells, get all the bacteria off, make sure bacteria is staying off. We also did a lot of things looking at the products we're using. So products we're using to clean our laundry, the water that we're showering in, those kinds of things are also very, very important. So if anyone's interested, I work with somebody called Mallory Miles. She's amazing. She's online and she has a lot of information to share. So check it out. Homestead question. I love homestead questions. When you're in the dreaming stages of homesteading, what are some things we can do now to prepare for it? That's a great question. I think the biggest thing you can do now is to learn skills that you're going to need to know when you're doing the homesteading. And what skills can you learn? Well, I do a lot of things with gardening. You can start gardening now. You can start gardening on your windowsill. You can start learning about how seeds work, about how to grow seeds. You can start learning about how to use that produce. So even if it's just when you go to the grocery store, get something new that you've not used before that you would potentially be growing in a garden. Figure out how to cook with it. Figure out how to introduce it to your family, those kinds of things. I had done challenges years before I had a homestead. I would do challenges. This was a few years before inflation, but we would do $100 months where we would say, okay, we're only going to spend $100 on basically the flexible expenses in our life. We didn't include things like car insurance or medical insurance or the mortgage on our home, any of those kind of fixed expenses we didn't include, but anything that was variable. So everything, meaning food expenses, entertainment expenses, just all the stuff you spend money on. We would do $100 month where we would say we are only going to spend $100 on anything like that, including food. And how are we going to do it? So to prepare for some of those months, what I would do is I would go and I would stock up on some canned goods, on things like a big bag of potatoes or a big bag of onions, foodstuffs that are whole foodstuffs, things. And then we would practice using those, a can of beans and an onion and a carrot. What can you do with that to make a meal? You actually can. So those are some things you can practice now, long before you're homesteading. Just practice, how do we utilize what we have on hand? What does that look like? So those are some really essential skills. Just getting out and doing some hard work, on Saturday morning. What do? Well, go out and do some things outside, rake some leaves, clean up some bushes, whatever it might be. Just get yourself kind of accustomed to being outside. I think that's important too. All right. Do I have a favorite electric toothbrush? I use a toothbrush called Burst. That's the one I'm using currently, and I quite like it. I actually did not like it at all when I started because it's more of a sonic feel and more of a vibration than a scrubbing. I used Oral-B for years, still like it. Sonicare is a great toothbrush. I just have chosen to use Burst. I think it's a little kinder to the teeth, so that's why I'm using it. How to teach tongue to the roof if it doesn't automatically go there? That's a great question. So we were talking earlier about when we nose breathe, it actually pulls the tongue to the roof of the mouth. So one thing to start with is practice nose breathing. Seal those lips. The tongue should go there automatically once those lips are sealed, once the teeth are closed. It should create a seal. There's things online. Go look up myofunctional therapy or myofunctional exercises. That's muscle function, basically. Go learn online. There's a lot of things you can go practice. How often should you brush toddlers' teeth in a day? And when do you start using toothpaste? Great question. You should brush them twice a day, just like you do yours. As soon as you have a tooth in the mouth, it should be brushed twice a day. And I start using toothpaste pretty much when there's 1 or 2 teeth in the mouth. I love my citrus tooth powder for kids because it's really gentle. It tastes great. They don't mind it. They can swallow it. No big deal. So I start using it when there's 1 or 2 teeth, and you don't have to use it on a brush. You can even use it on a on a washcloth. Just put a little on and just rub it on. Honestly, part of this, obviously, you're keeping the teeth clean. That's a real essential piece. But the second thing is they're getting used to you putting your hands in their mouth. If the toddler fights, what do? You do it anyway. This is one of those things that's worth it. This is a fight worth fighting. So you do it anyway. And eventually they'll figure it out that they're not going to win this fight. Go check out, I did a reel on social media where I showed how you tuck an arm behind your back. You hold the other hand with this hand so that you can kind of get that head position perfect. If they're screaming, well, better access for brushing, right? This really is, I know people will say, oh, you should never make your child scream. Well, what's better, this, cleaning your teeth every day? Because it's really, are you hurting them? No, of course not. They're just being a toddler and exerting their independence. Is it better this, or is it better to spend, $4,000 or $5,000 and have to have them sedated to be able to take care of the tooth decay? I think that this is definitely a better way to go because it's teaching them habits that they're going to need to know for the rest of their lives as well. And they're really not screaming because you're hurting or doing anything bad. They're screaming just because, they don't want you to do it. And they'll figure it out. There's a lot of things you're going to have to do in life that they're not going to love. They're going to figure it out. It's just okay. It's part of growing up and learning. And even as they get into like 4, 5, 6 range, you should still be brushing their teeth once a day. They can brush it the other time of day, but you should still be brushing. What are your thoughts on sorbitol and toothpaste? I don't like it, so I don't use it. So we don't have any sorbitol in our tooth powder at all. I don't think that it's I just don't like artificial sweeteners whatsoever. So we use a xylitol, which people may say, well, that's an artificial sweetener. Well, it's not. It's actually it's a sugar alcohol, and the bacteria can't eat it. So that's why we use it, because it actually prevents cavities. It's pretty amazing. How long do you think it would take to demineralize a small cavity? So if you're talking demineralizing, that means removing minerals from a small cavity. How long does it take? It depends on what's demineralizing it. If you're drinking, 7 cans of soda a day, well, maybe 3 weeks, because that's a lot of acid. If it's just a small amount of acid, a small amount of sugar, that kind of thing that's causing the problem, it could take months, 6 months, a year even. So it really depends on what's demineralizing it and what's the frequency of the contact with that demineralizing. Oh, remineralizing. I just read the next comment. Remineralize. How long would it take to remineralize? Well, remineralizing, again, depends on the depth of the cavity. So if it's a very, very shallow, small cavity, a month. If it's something deeper, a couple of months, but you should be able to see it within a few months' time. Hello, I asked about the cyst I've had for a couple of years that's not painful. I've had vitality tests and it appears the tooth seems to still be vital for now. What do you recommend? So, if a tooth, what they're talking about, I'm guessing, is a cyst that's at the end of the root. There's different kinds of cysts. There's cysts that are infectious cysts, meaning a buildup of bacteria at the end of the root. There's also cysts that are developmental, that are different structures that just developed wrong developed differently in the jawbone. So if the tooth is alive, that is the key component. If the tooth is alive, that means this is not an infectious cyst. It's probably a developmental cyst of some variety. So if it's not growing, if the tooth is not bothered, I would leave it alone. My 22-month-old has a small gap in her top front teeth and it's a little bucked, I think because of her pacifier. It's cute now, but will it stay that way? Will her adult teeth come in that way? Well, if she's still using a pacifier, most likely it will still stay that way. So this is why we talk about weaning off of that pacifier at about this age. You're 2 years out. This is time to start weaning off because teeth are developing, mouth structures are developing. If you have buck teeth, she may not be able to get her lips together to be able to nose breathe properly, which affects growth and development. It also is tongue position, which affects growth and development of the whole mouth. So a lot of issues. Really time to wean off the pacifier. Like you said, it's kind of cute now, but not. The gap usually will close because of lip pressure. So when the lips are able to go over those teeth, the teeth usually close on their own. Do you curl the tongue inside the mouth so it's not so cracked when you scrape it? I'm worried it would be too painful. Interesting. So when I tongue scrape, nope, the tongue goes all the way out. It goes all the way to the back of the tongue and all the way forward. Guess what? It may be painful. And the interesting thing at first, this is very interesting. When I first started tongue scraping, it was actually painful. It would even bleed a little bit. You know what happened though? It got toughened up over time. And what I found is that it was kind of sore and, like I said, even bleeding a little bit and cracked because of what was accumulating on my tongue. So as I began really routinely cleaning it every single night, the cracks went away, the soreness went away, it stopped having any issues at all, and now there's no problem at all with tongue scraping. So if that's your situation, if it's sore, then do it gently, very, very gently at first, and slowly your tongue will build up to resistance, and what's causing all that cracking will actually stop once you've been doing the tongue scraping routinely. Should I get my root canals out? Best alternative? Well, that's a loaded question, but it depends on the health of the root canal. So the starting point is to get a cone beam CT scan and see, is that root canal still healthy or not? And it's very apparent on the cone beam CT scan if it's not, if it has new infection or not. The alternative to a root canal, well, that's could be two questions. Number one, what's the alternative once a tooth is removed? If you have an old root canal that is infected, we replace it with a dental implant. We use a ceramic dental implant if at all possible. So that's the replacement for it. What's an alternative to a root canal to begin with? The key is the tooth still alive? If the tooth is still alive, then we do everything we possibly can. We use ozone to kill the deep bacteria. We do everything we possibly can to keep that tooth alive. So that's the key, is keeping it alive to begin with. If it's already dead, it's already infected, then we remove it and we replace it with a dental implant. Is it possible to get implants without using antibiotics? This is part of the process. Is ozone used instead when drilling down to the gum to put an implant and keep bacteria away? So that's a good question, and it's really going to depend on who you go to see for this procedure. So the reason that an antibiotic is used is simply there's a lot of bacteria in the mouth. And when we're doing any kind of, if we're doing a surgical procedure on, let's say, your arm, if I'm going to cut into your arm right here, what are they going to do ahead of time? Well, they're going to disinfect that with iodine and other surface disinfectants. They're going to clean it really well. And the only bacteria that could get on that during the surgery was anything that was coming from the air, right? So they're going to use really clean air in there. You're going to be able to keep that really, really clean. What about the mouth? When we're doing surgery in the mouth, it's very difficult to keep that surgical area very, very clean. Why? Because of saliva. Saliva carries bacteria. It's just part of what's going on in here. It's part of the ecosystem. So it's very difficult to keep that area bacteria free. We can't just dry it out and, swab it with iodine and keep it completely free of saliva, especially the second that you set up and go home and, it's going to be bathed in saliva again. So the mouth is a pretty hostile environment. Actually, it's a pretty difficult place to do surgery. It's amazing that we are able to do it successfully, honestly. So antibiotics are done to hedge your bets, basically, to hedge your bets to say, okay, let's see if we can keep the bacterial counts lower in that surgical site to make sure that your body has, doesn't have so many things against it when it's trying to heal. So what can you do instead? You can use an antimicrobial mouth rinse after post-surgically, which we always recommend. We use my mouthwash because it has colloidal silver in it, which is really great for this. You can also do IV antibiotics. So that's what we do in our office. If someone chooses not to have an oral antibiotic, and we respect that choice if that's yours, but you will have to do IV antibiotics. Typically, we recommend 3 to 5 days worth of IV antibiotics. Why is that better? Because it doesn't pass through the gut. You don't swallow it. So it doesn't do a whole bunch of gut changes. There is a little bit of the antibiotic getting to the gut, but it's minimal. So we see very little gut issues with IV antibiotics, and they're a little stronger, so you don't need it nearly as long as well. But that's the reason for it. We just don't want things to get infected. So it's a like I said, it's a hostile environment that we work in that mouth. Is it recommended to brush with bentonite clay? Yes, bentonite clay is in my tooth powder, but it's a cleanser. It's not a remineralizer necessarily. And there are other things that should be added to the clay, not just the clay on itself by itself. Can receding gums be repaired? Yes, receding gums can be repaired with gum grafting. The key, however, is that you figure out what caused the receding or the recession to happen before you start doing any kind of grafting, because the graft can recede just the same way. I am going to jump onto some of the other questions right over here real quickly. Okay, what kind of crown would be best after getting a ceramic implant? A ceramic crown, 100%. So someone asked me this, just a question today. What about a zirconia crown? Well, this is all about semantics. It's just words. Zirconia is a kind of ceramic. So when we say zirconia crown, when we say ceramic crown, when we say porcelain crown, we're meaning the same thing. It's a non-metallic crown. So some sort of a non-metallic crown, porcelain, ceramic, zirconia, all pretty much the same thing in essence, non-metallic. Okay. I can't find a dentist that does a zirconia implant, but it's possible I have an infection from an old root canal. Should I wait until I find a dentist that works with zirconia implants, or go ahead and do the titanium implant? Well, here's the thing. It depends on where your tooth is. You can get the tooth out and wait a bit while you're working to find somebody to do the zirconia implant, because the key here is the infection at the old root canal. So don't wait to get the infection out until you can find somebody to replace it. Get the tooth out, get the infection out, and then the implant can be placed later. Is it imperative that you get a zirconia implant and not a titanium? No, but there are issues with titanium. That's a whole long talk. Still a lot of issues with titanium. I have a titanium implant myself because it was placed, 30 years ago when there were no zirconia options at the time. Would I have zirconia today if I had the choice? Absolutely, I would. So could you do titanium? You can. And there's still millions of titanium implants placed every single year. Just know that there may be some issues down the road with that implant. But it's all about choice. It's all about choice. Which kind of risk weighing your risk, and on health. What is your health like? Can your health handle some metal in there? Those are all questions that you have to answer. I have crowns over my still live ground down teeth, 2 of them still live. So they're still alive. Good. How do I keep them from being sensitive? I've had them for about 4 months. Also this past week, and the gums over those 2 crowns were so sensitive that I couldn't brush. So I used some oregano with myrrh, and now I can brush. Should I still see a dentist for evaluation? What I would do is I would absolutely try the sensitive tooth powder. Most likely what's gone on, when they do a crown, what happens is that they remove the enamel around the outside of the tooth, which is in essence the insulation. So when that enamel is removed, it can really sensitize a tooth. Some of it may be cement, some of it may be other things, but the first thing I would try is the sensitive tooth powder and see if you can't get that to calm down. I would also use it. I would brush, and then I would make a little paste of it and rub it around those crowns, and then just go to bed at night so that it sits on there and really soaks in and does its job. I would also try the remineralization supplements, vitamin D and K, and the tooth and bone formula. See if you just can't get some more minerals into you, because it may be that there's just not enough minerals to go around and not enough to really fill those tubes back up and make them desensitized. Tooth powder will also help with those gums that are sore. Sounds like those teeth are just irritated. They're just super inflamed right now. So I would absolutely give the tooth powder a try. I would also try our elderberry with inflammation, and I would use that as a rinse. I put the elderberry with inflammation in the mouth. I would just kind of swish and hold it over wherever those crowns are, and then swallow it because you want that immune boost. But that will really help with inflammation as well. There's turmeric, there's trying to remember everything that's in there, ginger, things that are all going to combat that inflammation. Okay, I am missing tooth number 30 and 31. So those who don't know, that's lower right. I can't have implants yet. I had pain in that area. After using your tooth powder, the pain decreased. I also started eating soft food on that side. I didn't eat on that side for a year. Is it helping? Is it helpful to eat both sides even when I'm missing those two teeth? First of all, I'm so glad the tooth powder helped. That's awesome. It's probably helping to build those bones a little. But yes, it is helpful to chew on both sides, just because bone, when it has a job, stays there. When it doesn't have a job, it actually starts to resorb. So give that bone a job. Start chewing with it. Should I get a root canal on an upper right canine? Periapical lucency, it has no pain. So lucency means there's an abscess at the end of the root. So first of all, you need to determine, is the tooth alive, or is this a cyst like we talked about a little earlier? So you're going to get this vitality tested. You can do that electrically. There's an electric pulp tester that we can use. You can use that with cold. A couple of different things we want to see. Is that still alive? If it has no pain, then you have a choice. You get a root canal with a chance that that is going to infect in the future, or do you have the tooth removed and place a dental implant now? This is all your choice, and you get to decide based on your symptoms, your overall health, all those kinds of things. They all play into the decision. Do you see a lot of bridges put on a front tooth? And how many teeth is a healthy bridge? So there are intrinsic problems with bridges. So let me talk about this just a bit. We're almost getting to the end here, which is good. The problem with bridges is that you have two crowns that are holding the bridge in place and then a missing tooth in the center. Well, when you chew on, let's say you chew on this side, it's going to push this down and this up. When you chew on this side, it's going to push this down and this up. So what it does is it torques this piece because it's all one piece. So all of that together is going to torque like this as you chew. Well, that torquing creates a lift around the seal, around the edge of the crown, around here. So it lifts off that crown, and eventually it will break the cement seal. And what research shows, and this is really well researched, what research shows is that it's a real high risk that you're going to lose one or both of the teeth that are holding that bridge eventually over time. Because that cement seal is broken, you don't know about it. Bacteria get up underneath that crown. You can't see it. You can't brush it. We can't see it because it's blocked on an x-ray until it's very large. And then at that point, the tooth is usually lost. So bridges are problematic. If the bridge is your only option, then you just have it checked very frequently and very meticulously every 3 to 6 months to make sure that things are still staying well. I would not do any more than 3 teeth on a bridge. If you start going further than that, you're asking way too much of the teeth that are holding the bridge, and you will be losing one of those teeth, most likely. Research shows, risk shows you most likely will be losing one of those teeth. Now, there is one other kind of bridge on front teeth that you can do, something called a Maryland type bridge, where it's a wing on the back side of the two teeth on either side. If that's the case, they don't use a full crown. And so it pretty much changes the whole conversation I just had. It's a wing on the back side of those teeth. It doesn't damage the teeth. It doesn't lift up and down and let in bacteria. If it comes loose, you're going to know it because the whole thing's going to be moving a bit. So hopefully, if you're talking about a front tooth, you're going to be able to talk about doing a Maryland type bridge. What are your thoughts on red light therapy on the teeth? Red light therapy is phenomenal for decreasing inflammation. So if there is something going on inflammatory wise on a tooth, this is going to be great for that. So red light therapy is awesome. All right, I'm going to grab one more and then we're going to jump off. I lost a small square of what I believe is dentin on the back of my lower bottom tooth. I have only been using your toothpaste for a short while, but I'm hoping it will replace lost dentin. Well, it probably won't replace everything that you're lost. That's asking a lot of the hydroxyapatite, but what it does is it plugs the tubes on the exposed surface. So it makes it at least more sealed, but it doesn't necessarily rebuild. So you may need a filling there if there's a fairly decent amount lost. Okay, I'm at the end of my time that I have available today. I love these questions. Keep them coming. Keep coming here every single week. Keep asking. Let's keep learning together. I love it. Thank you all. Have a fabulous week.